The topic today we are going to discuss is pancreatic cancer. The main learning objectives of our this topic will be following. What is pancreas? What is pancreatic cancer? Signs and symptoms. Causes of pancreatic cancer. How to diagnose and treatment of pancreatic cancer. First of all, we will start from the introduction of pancreas. Pancreas is a small hockey stick shaped gland located behind the stomach. So basically it is located behind the stomach, as you guys can see in the picture. Its main function is to help in food digestion and blood sugar regulations. It helps food digestion by releasing certain hormones or enzymes. It maintains sugar levels by two hormones. These are insulin and glucagon. So, what is the definition of pancreatic cancer? Pancreatic cancer occurs when changes or mutations in the pancreas cells leads them to multiply out of control. So, a mass of tissue results, and this leads to malfunctioning of pancreas and ultimately to pancreatic cancer. Sometimes this mass can be benign or sometimes it can be malignant as well. However, pancreatic cancer is usually malignant. Most of the time pancreatic cancer will be malignant and survival rate will be very low. What are the types of pancreatic cancer? There are mainly two types of pancreatic cancer. It can be exocrine or it can be neuroendocrine tumors. 93% of total exocrine cancers occur. So most of the time we will have exocrine origin type of pancreatic cancer. These exocrine pancreatic cancer cells are also known as adenocarcinoma. And the benign form is ductal adenocarcinoma. Those type of tumors are cancers that occur in the ducts of pancreas. These are called as ductal adenocarcinoma and these are benign in origin. What are the signs and symptoms of pancreatic cancer? Upper abdominal pain that may also radiate to back. So, if a person complains that he is having abdominal pain and that is radiating to his back, his her back as well, it will be a sign of pancreatic cancer. Yellowing of white parts of the eyes, tiredness, loss of appetite, light colored poop, dark colored pee, weight loss, blood clotting, itchy skin or irritation on the skin of the patient, new or worsening diabetes as well, and person presents with nausea as well as vomiting. So basically these are the main signs and symptoms of a pancreatic cancer patient. If we talk about the risk factors, first of all, smoking. Smoking is the main causative factor of pancreatic cancer. Diabetes as well. Chronic inflammation of pancreas, that is also called as pancreatitis. Family history of genetic syndrome. These family history of genetic syndrome are related to BRCA2 gene mutation. This leads to the genetic syndrome of pancreatic cancer. Lynch syndrome and familial atypical mole malignant melanoma syndrome. Family history of pancreatic cancer, obesity, and in old ages, the pancreatic cancer can also occur. How to diagnose a pancreatic cancer? First of all, ultrasound is the mainstay of investigation to diagnose a pancreatic cancer. We, by having any ultrasound, we can see the deformities in pancreas. MRI is also an important investigation. CT scan and by detecting by detecting tumor markers. So, which tumor markers are most commonly used? There are mainly two tumor markers. First one is CA19-9 and the second one is CA50. They are strongly exposed in tissue specimens where pancreatic cancer is present. So if we take a tissue specimen of pancreas of a patient having complaint of pancreatic cancer, then there will be two tumor markers. These are CA19-9 and CA50. These antigens are released into circulation and are found in increased concentration in 70 to 80% of patients with pancreatic cancer. How screening of a pancreatic cancer patient done? Patients who have family history of pancreatic cancer should have regular screening because genetic causes are also important. Screening usually starts at the age of 50 normally, but individuals who are having cases of pancreatic cancer in their family or close relatives as well, they should be screened at the early ages. What are the treatment options available to treat a patient of pancreatic cancer? Surgery, distal pancreatectomy, total pancreatectomy, Whipple procedure, chemotherapy, radiotherapy, chemoradiotherapy, and targeted therapy. So first we will see how surgery is done. Surgery is the most important option to treat a pancreatic cancer patient. But this cancer is usually after it is widespread. Sometimes radiation therapy is also required along with it. If we talk about distal pancreatectomy, so in this case, parts of pancreas such as body and tail as well as spleen is removed and spread of cancer can be prevented. If we talk about total pancreatectomy, then we remove whole pancreas including common bile duct, gallbladder, spleen and nearby lymph nodes. If we talk about Whipple procedure, then we remove the head of pancreas as well as gallbladder and parts of bile duct that are present in stomach and small intestine. So the others are additional treatment options for patients of pancreatic cancer. Chemotherapy. In this case, the tumor is removed with the help of drugs. So certain drugs are used by medical experts to remove that tumor. Radiotherapy is also used. So radiations are used to kill the cancer cells present in the pancreas that are actually causing factors of pancreatic cancer or tumor. Chemoradiotherapy. These are actually combined use of radiations and drugs. In this case, the radiations as well as certain specific drugs are used combined. So the effect of medicine or treatment is enhanced. And the other is targeted therapy. In targeted therapy, we use drugs and other substances that target cancer cells and they either kill these cancer cells or stop their proliferation. So, what is locally advanced cancer? If the cancer is locally advanced, then biliary bypass is used if the cancer is blocking the bile duct and boil continually. Endoscopic stent is used to drain that bile. Gastric bypass is done if tumor block food from leaving the stomach. If and we have pancreatic cancer vaccine as well available in markets. An mRNA vaccine treatment called autogene cevumeran that is tailored to each individual cancer patient. It is very promising in its initial trial. It targets immune system to destroy cells which has mutated protein. Gene therapy is also an advanced technique to treat pancreatic cancer patient. Experimental approach involved taking a sample of Wilkie's T cells, a type of immune cell that attacks invaders in the body is taken. Scientists genetically modify these T cells that attack tumor cells only. These cells are multiplied billions of times before injecting into the body to have its better effects. So what is the survival rate for pancreatic cancer? Prognosis. Its prognosis depends on which stage the tumor is detected. It depends on the size and type of tumor, lymph node involvement as well, and degree of metastasis at time of diagnosis. Either it is spread to lymph nodes or other body parts or not. Unfortunately, pancreatic cancer produce until it is widespread, making survival rate very difficult. This cancer or pancreatic cancer is mostly incurable, but it is curable if it is detected at the early stages of the disease. Patients in which tumor spread has occurred, the average survival rate is 3 to 3.5 years. I hope you guys like my video. If you really did, then kindly like, subscribe, share my YouTube channel. Thank you.